Hey, my name is Ray, and I'll be taking your x-rays. In this video, I'll be showing you how to position for your rib series. I'll be demonstrating how to position for both a bilateral and unilateral respectively when ordered. It could be a tricky exam. For me, it was hard to remember when a collimate skinny or wide and getting that obliquity correct. Other problems students have are getting the central ray in their correct position for unilateral oblique. It's tough to perfect something when it's rarely ordered, so if you're wanting to perfect your positioning for when you try for that sign-off, or you have a practical coming up, this video is for you. Hit the like button if you appreciate these positioning videos. I put a lot of time in them, and a like goes a very, very long way. Thank you for all the love and support. Hope y'all doing well, and without further ado, let's go! Alright, my name is Ray. I'll be taking your x-rays. We're looking at your ribs, right?
Right.
Correct?
Correct.
You fall or something, or?
Yeah, I fell and hit my ribs.
Okay, what side is hurting?
Right side?
Right. The right side? Okay, no worries. So we'll take a look at that. They want to look at your lungs as a whole first, and then we'll just look primarily at the ribs there, okay?
Okay.
So I'll have your chest up against the board there for me, please. Get everything lined up to your height. Do you have any questions?
No, I'm a little on the short side, I think.
Yeah, you are. Yeah, no worries. Let me just get this all lined up here. And then I'm going to give you some breathing instructions, okay?
Okay.
And just relax your shoulders down and roll your shoulders forward and arms around the board to the sides there. There we are. Okay. Here we go. Take a breath in. Blow that out. Take a big deep breath in and hold. Breathe. Okay, you can relax. And can you point to me where the pain is at? Is it more in the front or the back?
It's the front.
More in the front? Okay.
Right here.
Alrighty. So I'll have you have your chest up against the board there again for me. And then we're going to slide over a little bit to your left. Alright, there's good.
You want my arms forward again?
You can just kind of relax this one down, but we'll have your right arm kind of just right over there. That would be good. Alright. Cool. And just hold still there. And go ahead and take in a breath in and hold your breath. Breathe. Okay, keep your arm up there. We're going to rotate to your right just a little bit, right about there. And we're going to bring it over a little bit more right there. Good. Take a breath in and hold. Breathe. And then now we're going to put your right hand on your right hip there, and then we're going to turn to your left about halfway right there. And good. Hold still there. Take a breath in and hold. Breathe. Okay, and then now I'll have your back against the board. And it's going to feel the top of your hip here. Take a breath in and blow it out. Just breathe normal. Hold still there. All right, this time, breathing instruction is a little bit different. Take a breath in and blow all the air out. Don't breathe, don't move. You can breathe, and we're all done. Thank you very much.
Thank you.
Okay, so now we're gonna put your left hand on your left hip there. Leave your right hand up there. We're gonna turn you about halfway. Turn your shoulders as well. Keep going. Right there. Good. All right, hold still there. Take a breath in and hold your breath. Breathe.
I did what you don't want me to do.
Oh, I didn't see. Damn.
Okay.
All right, we're gonna do that one more time again, ma'am. When I tell you to take a breath in, don't move your shoulders. Just take a breath in with your lungs, okay? Does that make sense?
Yep.
You're kind of moving too much that last time. All right, go ahead, take a big deep breath in. Hold your breath. Breathe. Okay. So now we're going to turn to your left. Put your right hand on your right hip. Put your left hand right up here. Good. Great. Hold still there. Okay, all right. Take a breath in and hold. Breathe. So we'll just bring your left hand on your head here. Oh, that's fine. We're up there.
You said it, but you did this.
I didn't see that. We'll cut that out.
Okay.
So we're going to turn you halfway. Good. And then we're going to slide you over a little bit. So let's come back over here. So, like that. So we'll just turn halfway to your right. So I'm gonna turn or slide you over more. Move your feet. Right there. Alright, my name is Ray. I'll be taking your x-rays. We're looking at your ribs, right?
Right.
Correct?
Correct.
Do you fall or something, or?
Yeah, I fell and hit my ribs.
Okay, what side is hurting?
Right side?
Right. The right side? So first, I get some history from my patient and figure out exactly where the pain is. That way, when I position, I know which side is the affected side and then place that side closest to the wall bucky. Before we image the ribs, we image the lungs. So first, we have the PA chest. Remember, when positioning your patient at the wall, you move the tube first and then align the bucky to the tube. I center the central ray mid-sagittal and at the inferior angle of the scapula. Down and roll your shoulders forward and arms around the board to the sides there. I tell my patients to relax their shoulders down, rotate them forward, and arms around the board to the sides. It gets them in the correct position almost all the time. Here we go. Take a breath in, blow that out. Take a big deep breath in and hold. I was taught to give my patient a preliminary inspiration to allow for a bigger inspiration on the second. You can relax.
And can you point to me where the pain is at? Is it more in the front or the back?
It's the front.
More in the front? Okay.
Right here.
So since my patient's pain is anterior, I position them PA, affected side against the bucky. For unilateral, I center the central ray between the mid-sagittal plane and the humeral head. I then collimate side to side to a little laterally past the MSP and a little laterally past the humeral head.
There. That would be good. All right. Cool. And just hold still there. And go ahead and take in a breath in and hold your breath. Breathe.
At my facility, it doesn't matter which oblique you start with. I'm not sure it matters anywhere else, but here I start with an LAO. Left anterior side is against the bucky and oblique. I know it says 45 in the book, but it's more like a 30-degree oblique. I put them in a 45 and then flatten them out a little bit. Works almost all the time. I then center my central ray between the spinal column and the humeral head. Then collimate side to side, a little laterally past the spinal column and a little laterally past the humeral head. If you noticed, even though the left side is down, I mark the side that is being imaged, which is the right side. Now, how to remember when to collimate wide or skinny. Remember this, they teach you in Merrill's to either position your patient's arm up or down. Whenever you position your patient's arm up, you collimate wide. When you position it down, it's skinny. If you would like to share how you remember this another way, please let us know down in the comments.
Breathe. And then now we're gonna put your right hand on your right hip there, and then we're gonna turn to your left about halfway, right there.
Now this definitely wouldn't make my highlight reel, but I left it in for a learning opportunity. If I actually shot this, collimation would have been way too wide and central ray is off to the left. However, would it be repeatable? The answer would be no, because the area of interest would have been captured and the patient's position is correct. Unfortunately, there is unnecessary exposure.
Take a breath in and hold. Breathe. Okay, and then now I'll have your back against the board.
My facility's ribs protocol calls for AP lower ribs. So I position my patient AP, get the SID to 40 inches, central ray at MSP, and then what I do next is I feel for the patient's iliac crest. My light will be superior to this, never lower. I'll collimate to the lower half of the patient's torso. As you might have seen, my light is actually past the crest, so looking back at this, I should have kept my collimation, but instead moved my central ray superior past the crest.
Hold still there.
For my breathing instruction, I make sure to have my patient blow out all the air to get the diaphragm as high as possible.
All right, this time, breathing instruction is a little bit different. Take a breath in and blow all the air out. Don't breathe, don't move. You can breathe, and we're all done. Thank you very much.
Thank you.
So in my opinion, bilateral ribs are pretty easy, as you can leave the collimation pretty much wide open. Just make sure you get the obliquity correct and the part in the box.
Going right there. Good. All right, hold still there. Take a breath in and hold your breath.
Well, they should be easy at least. Lori here demonstrates what happens every now and then when you get a difficult patient. This is why you should always pay attention to your patient and not the monitor when you're about to expose your patient.
Your lungs, okay? Does that make sense?
Yep.
You were kind of moving too much that last time. All right, go ahead, take a big deep breath in. Hold your breath. Breathe. Okay. So now we're going to turn to your left.
You can follow the same positioning instructions for the other oblique.
Good. Great. Hold still there. Okay, all right. Take a breath in and hold. Breathe.
I also wanted to demonstrate a unilateral LPO RPO for you.
So we'll just bring your left hand on your head here. Oh.
A reminder, you should always be aware of your surroundings and move the arm rail if possible.
We'll cut that out.
Okay.
Now, if this went as planned, Victoria's arm would be up, so you collimate. Why? The central ray splits between the spinal column and humeral head. Collimation is laterally past the spinal column and laterally past the humeral head.
So we'll just turn halfway to your right.
Arm is down. Collimation, skinny. Central rays split between the spinal column and humeral head. Collimation is again laterally past the spinal column and laterally past the humeral head. Left marker is used because the left side is being imaged. She also looks a little bit too steep, so I should have flattened her out a little bit. And there you have it, how to position for your rib series. As you can see, the unilateral obliques are where it gets kind of tricky. I also want to talk about collimation. Where I went to school, tight collimation was a big emphasis, and for good reason. However, if you collimate too tight, your patient may move and you clip the area of interest, which results in a repeat and double exposure. In my opinion, I prefer to find a middle, not too tight and not too open. A little bit of wiggle room just in case. I'd rather open it up a little and get it right on the first try than get it too tight with the increased chance of a repeat. That's just me though. However, it does look pretty impressive when you get it. The tech will say, sheesh, it's pretty close, living on the edge there, but you got it. Not too much praise because they know sooner or later you're gonna clip. I was that student. But whatever you do, do not be lazy. Don't just leave it wide open. Show you at least tried. Have some pride in your profession and respect for your patient. Unfortunately, you're gonna see this a lot from other techs, but don't say nothing. Trust me, just don't. I know it's hard. Ugh. Instead, lead by example. You also might have noticed there are no BB markers in my demonstration. Some facilities use BB markers to indicate where the pain is. However, we don't use it because the patient may place the marker directly over the fracture. As you can imagine, that would be an issue. So we instead annotate with an arrow to the area of interest. There are actually several different protocols for ribs. Some places cone in to the area of interest. What we're actually doing now for unilateral exams is getting your PA chest, then positioning your patient in either an RPO or LPO, the affected side down, and then getting an upper and lower shot of the affected side, and then an up shot for your lower ribs. What you'll do depends on your facility. But in this video, I just wanted to cover the fundamental positions. Now, if you found this video helpful, press that like button, subscribe for X-ray content, and share this video with others who may find it valuable. Head over to xrayready.com and grab yourself a technique card when you need that ballpark technique in the clutch. And also, check out the clothing section and cop some merch if you are so inclined to. Hope y'all are doing well, staying positive, and staying away from the negativity. You have greatness within you. I'll see you at the top. My name is Ray, and I'll be taking x-rays. All love. Peace.